One.
Alright, McGlure, so because you told me that you have numbness and tingling from time to time in your fingertips, I have reason to suspect you might have thoracic outlet syndrome. So today we're going to do two special orthopedic tests that test for thoracic outlet syndrome. Okay, so the first test we're going to be doing is Adsons test. So what this tests for is compression of the neurovascular bundle, which is in between your anterior and your middle scalenes. A positive sign of that would be a loss of the radial pulse. So how I'm going to determine whether you have it or not is I'm going to get you to extend your head and rotate while I bring your arm back and externally rotate that while holding your radial pulse. Again, as I said, if the radial pulse diminishes or you feel numbness and tingling in your hands, then that is a positive. The second test I'm going to be doing is Wrights Maneuver. So what this tests for is compression of the brachial plexus from the pec minor. How I'm going to test for this is I'm just going to hyper abduct your arm up to the ceiling while holding the radial pulse again. And again, if the radial pulse is gone or you feel numbness and tingling in your fingers, then that is a positive test. Benefits to this is I'm going to be able to understand whether you have thoracic outlet syndrome or not, and what is causing your thoracic outlet syndrome. Risks are you might feel numbness and tingling or a little bit of pain depending. Please know that you have the right to stop at any time. Do you have any questions? Alright, make sure you keep in mind the pain scales that are 10. Do I have your consent?
Yes.
So the first one we're going to do is Adsons. So, can I have your arm? Okay, just going to go for your place. Okay, now just extend your head and rotate to this side. So look at me. Okay, so I'm just going to externally rotate your arm and extend. The pulse isn't diminishing, so that's a negative. The second one I'm going to do is Wrights Maneuver or hyperabduction, so I'm going to have your arm again. Okay, I'm just going to hyperabduct. And again, the pulse stays the same, so I'm going to say that both of those tests are negative. Okay, McGlure, so from your test, I found that you were positive with Wrights Maneuver or the hyperabduction. So from that, I am going to make an MT diagnosis that you do have thoracic outlet syndrome, stemming from your pec minor. So let's talk about the treatment plan a little bit. I'm going to set you up for weekly treatments, 45 minutes for 5 weeks. On the third week, I will be reassessing you, so I'll just be doing some of the same testing that we already did. So in your actual treatment plan, what I'm going to be doing is warming up the tissues. There's no real risks other than it could get a little too warm, but I'll be checking in on your comfort level. Benefits of this are that the tissues will become looser and I'll be able to work with them better. So after heat hydrotherapy, I'll probably move into superficial techniques such as effleurage, just warming up the tissues manually with my own hands. After that, I'll be moving into petrissage, so muscle squeezing, specific compression, broad contact compression. And then after that, I'll be moving into more neuromuscular techniques such as muscle stripping, frictions if I feel the need, just more deeper techniques. And then I'll work my way out after that. Benefits of this is the safe and effective treatment plan from the assessments, and we're going to work to diminish the effects of your thoracic outlet syndrome. Risk of this is I might apply pressure a little too strong, but I said I won't be checking on your pressure. And keep in mind the pain scale is 0 to 10. If I ever get out of that pain scale, say if I ever range between a 6 and a 7, just let me know and I can lessen my pressure. Other risks are, like I said, with the heat hydrotherapy, it might be a little too hot, and some techniques might recreate the pain, but we're going to try to diminish that as best as we can. Also with this treatment plan, I want to talk about remedial exercise, so I'll just be showing you a little bit of a doorway stretch for your pec minor, and I'm going to do those with you in the treatment as well as you're going to do them at home too. Do you have any questions? No? Do I have a consent for treatment?